am Dr. Karthik SM, consultant physician and diabetologist working at Narayana Health HSR Layout. Today, I'll be talking about latest updates in hypertension. Before proceeding to the actual talk, a few statistics regarding the burden of hypertension on healthcare system. As per WHO, nearly 63% of the total deaths in India are due to non-communicable diseases, of which 27% are attributed to coronary vascular disease, which affects about 45% of the people in the 40 to 70 year age group. Raised blood pressure is among the most important risk factors for CVDs. Moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow-up. In India, the prevalence has gone up over the past 30 years from 29% to 38% in men and from 28% to 32% in women. Despite that, nearly half the people, or 51% of men and 41% of women with hypertension, are unaware of their condition. Additionally, over 62% of the men and more than 53% of women living with hypertension did not get their treatments. Medication was used to control the blood pressures in fewer than 1 in 5 men and less than 1 in 4 women with hypertension worldwide. Indian International Society of Hypertension has released ISH 2020 Global Hypertension Practice Guidelines. They have included something called as a optimal as well as essential treatment paradigms, which attempts to address the issue in resource poor settings as well. Optimal care refers to the evidence-based standard of care, whereas in a resource poor settings, essential standards, which refers to bare minimum standard for care, is acceptable. The American Heart Association as well as American Cardiological Society has released a scientific statement in 2021 offering the new guidance for management of stage 1 hypertension among patients with the low ASCVD risk. Among the low risk adults who have no ASCVD or 10-year CVD risk of less than 10% with stage 1 hypertension. That is, if the BP lies between 130 to 139 systolic and 80 to 89 diastolic, management starts with a non-pharmacological therapy. If the blood pressure remains uncontrolled at 3 to 6 months, we can consider starting them on pharmacological therapy. Coming to the next guidelines regarding use of antihypertensive ARDS. ARDS is a potentially fatal condition involving the lung damage commonly seen with severe COVID-19, H1N1, and severe pneumonias. A recent study which appears in the Journal of American College of Cardiology reports that metoprolol can reduce the lung inflammation and improve the respiratory function in people with COVID-19 induced ARDS, as described in Journal of American College of Cardiology, September edition. Lowering systolic blood pressure targets down to 110 to 130 from 130 to 150 range substantially reduce the cardiovascular outcomes in a step randomized trial, affirming the sprint findings for an older Chinese population. This study was done in age group of 60 to 80 people in China, and about 8,500 patients were enrolled. The intensification of the BP targets down from 130 to 150 to 130 to 110 actually reduced the 26% of the composite severe risk. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European guidelines on the management of arterial hypertension recommend that the diagnosis of hypertension should not only be dependent on the office BP measurements, but also an out of the office measurements such as ambulatory blood pressure monitoring or home blood pressure monitoring. 24-hour and nighttime BP measurements were associated with greater risks of mortality and composite of CV outcome. Thus, they may be considered as the most relevant measurements for estimating a cardiovascular risk. For every 20 systolic and 10 diastolic increment in the blood pressure measured at night, the risk of mortality increased by 23% and the risk of cardiovascular events by 36%. Coming to the next update, most patients with hypertension require lifelong medical therapy to achieve an optimal BP control. The 2018 European guidelines equally recommend 5 classes of antihypertensive drugs. Considering the high non-adherence of treatment, the importance of combination treatment is particularly highlighted to improve the adherence to therapy as well as a BP control. Therefore, the 2018 European guidelines recommend, especially in the context of low BP targets, to start antihypertensive therapy with the initial dual fixed dose combination of AC inhibitors or a angiotensin receptor blockers, along with a calcium channel blocker or a diuretic. Next update. Since early 2018 July, products containing valsartan have been recalled worldwide. The reason is detection of a carcinogen, namely NDMA, which can be found in candesartan, irbesartan, losartan, as well as valsartan. NDMA has been classified by WHO, Agency for Research on Cancer, to be carcinogenic in humans. The dosage contamination of NDMA is predicted to be very high. If 1 lakh patients would have received NDMA contaminated valsartan from Beijing every day for 6 years in the highest dose, it could result in 22 additional liver cancers over the lifetime of these patients. The presence of NDMA in these drugs could lead to 8 additional cancer cases per 1 lakh population if taken at higher dose over 4 years of period of time. Next, the HYGEA study represents the largest study that tested nighttime antihypertensive treatment. In this trial, chronotherapy was associated with a significant reduction in endpoints, including death. The HYGEA chronotherapy trial tested whether nighttime therapy, in comparison to the usual upon wakening hypertension therapy, exerts any favorable CV risk reduction. The largest study included a total of 19,084 hypertensive patients, and during an average follow-up of 6.3 years, 1,752 participants experiences primary CV outcome. An ambulatory BP measurement was performed for 48 hours to collect the data how the BP differed during the sleep. The relative risk reduction for a CV event was significantly improved for nighttime treatment when compared with awakening treatment. Thank you.